Good morning, everybody. It is an absolutely stunningly beautiful spring day here in Minnesota, and I am so glad that you are willing to come in out of the snow to spend some of it with us. I want to welcome you to the Health Disparities Roundtable on Discrimination in Healthcare, What Can Be Done. And I'm John Finnegan. I'm a professor and dean here at the University of Minnesota School of Public Health. And for many of you, this is a return visit since you've been attending the Health Disparities series for a number of years. I think we're well over a decade at this point in doing this event. And so to all of you, I say welcome back. And to those of you who are attending for the very first time, let me just say that I have no doubt, I am very confident that you are going to find this morning's presentations and the ensuing discussions stimulating and thought-provoking, and at times you may even find them a bit frustrating as we get into the difficulties and the complexities of health disparities and the challenges to health equity that they create. Today is a day during Public Health Week when we share our collective evidence, our insights, and our perspectives as we attempt to more fully understand and seek effective and sustainable solutions to this very urgent topic. I might add that we are recording this session for later streaming on our website, so those of your colleagues and friends who are unable to be here today will be able to get a chance to see this. So you will be on the web, and that means that we need to behave ourselves. And this might be a really good time to turn off or put on vibrate those wonderful little electronic devices that everyone in this room is carrying with them. So you might want to try that right now, just as we get going. So an event like this always takes time and talent and teamwork to plan and deliver. And I want to acknowledge the work of the organizing committee of faculty, staff, and students from the School of Public Health Health Equity Work Group and the Medical School Program in Health Disparities Research. And I also want to acknowledge the sponsorship of the Schools of Public Health and Medicine and other sponsors as well. The Center for Leadership Education in Maternal and Child Health here in our school, the Midwest Center for Lifelong Learning in Public Health, Region 5 Public Health Training Center, and the Center for Healthy African American Men through Partnerships. Please join me in a round of applause for our sponsors. So while Minnesota as a whole is considered one of the healthiest states in the country, we know that we face the challenge of health equity more so than many other places in the United States. Within shouting distance of this room, there are communities of color and American Indians where life expectancy is a decade less than for European descendants. Too many in the Minnesota community are not reaping the rewards of good health and well-being. The root causes, social determinants that shape the conditions of our collective health in the first place. The gaps in income, education, access, and quality health care are continuing challenges for all of us day after day, year after year. And yes, racism is one of those social determinants in its many forms. Structural racism has been described this way. It is the normalization and legitimation of an array of dynamics, historical, cultural, institutional, and interpersonal, that routinely advantages whites while producing cumulative and chronic adverse outcomes for people of color and American Indians. There is also institutional racism that has been described this way: discriminatory treatment, unfair policies, and inequitable opportunities and impacts based on race, produced and perpetuated by institutions. Individuals within institutions take on the power of institutions when they act in ways that advantage some and disadvantage others based on race. So today, we discuss these challenges in our healthcare system and what can be done to mitigate, if not eliminate them. No matter how we label the issue, however, the bottom line remains the same. At the very heart of the matter, at the very core of our beliefs, is the principle of doing what's right for people. It's knowing that we must find solutions that give everyone an equitable shot of keeping and achieving good health and well-being. It's doing right by the people that propels us to come together in venues such as this, to listen, to discuss, and to seek solutions to such seemingly insurmountable challenges. We know we must join forces, for no single individual, no single group, no single institution, and no single government agency can resolve them alone. And that's why we're here today, to move the needle, to address the structural factors that bar our progress, and to use our collective wisdom and the public health venue to help tackle this very complex problem, issue, challenge from a wide variety of angles. Thank you all for being here today. It is now my pleasure to hand over the podium and to our moderator. And let me introduce her. She is Dr. Rachel Hardiman. She is Assistant Professor of Health Services Research at the Mayo Clinic. You may have heard of the Mayo Clinic. It's south of us in Rochester, Minnesota. Actually, the very existence of the School of Public Health was because of a bequest from the Mayo brothers. So we have a lot in common with Mayo. And we're delighted to have Rachel here today representing not only Mayo, but also this great challenge that we have as our moderator. She is an assistant professor of health services there, and her research, I might mention, by the way, she's also been a research fellow at the Department of Medicine here at the university. She's been a VA-associated health postdoctoral fellow at the Minneapolis VA, and she has also worked as a research associate at the Wilder Research Center just down the Green Line a few miles. Her most recent publication is in academic medicine, and the title of it is A Comparison of the Mental Health and Well-Being of Sexual Minority and Heterosexual Medical Students, a report from the Medical Student Change Study. And I have been told I'm allowed to say this. It is my deep pleasure to let you know that Rachel will be joining the faculty of the School of Public Health in the not-too-distant future. Ladies and gentlemen, please welcome Dr. Rachel Hardiman.
Good morning, everyone. I am really excited to be here and to introduce the esteemed panel that is going to be sharing their research and their work and their insights on this incredibly concerning problem we have around discrimination in healthcare. I'm going to read each of the speakers' bios, and then I'll ask our first speaker to come up on stage and start the discussion. So first we have Dr. Gilbert C.G. He is a professor in the Department of Community Health Sciences at the Fielding School of Public Health at UCLA. His research focuses on the social determinants of health inequities of racial, ethnic, and immigrant minority populations using a multi-level and life course perspective. A primary line of his research focuses on conceptualizing and measuring racial discrimination and in understanding how discrimination may be related to illness. Dr. G is currently the editor of the Journal of Health and Social Behavior. His talk will be followed by Dr. Michelle Van Ryn, who is a professor of health services research at the Mayo Clinic College of Medicine and director of the research program on equity and inclusion in healthcare in the Division of Healthcare Policy and Research. She's also founder and owner of Partners in Equity and Inclusion. Her research focuses on the equity and quality of healthcare encounters for patients and families, with a special focus on the ways that individual and social interaction processes influence interpersonal quality of care and clinical decision-making. Finally, we have Monica Hurtado, who is a racial justice and health equity organizer for Voices for Racial Justice. She grew up in Colombia, where she trained as a family medicine doctor. From 2013, she worked with Aquí Para Ti, or Here for You, a clinic-based Latino youth development program funded by the Eliminating Health Disparities initiative. She was also one of the founders of the Alliance for Racial and Cultural Health Equity, leading efforts around race, ethnicity, and language data. Dr. Hurtado brings skills in policy, public health, and community organizing to her work at Voices for Racial Justice. So I would like to encourage you all, if you are social media savvy, to tweet along at hashtag SPH Roundtable. I think we have a great panel of speakers here this morning, and at the end, we'll have about 40 minutes for questions. So make sure you are jotting down your questions on those cards that you receive with your program, and there'll be people to kind of collect them. And also we'll have some microphones around so that you can ask your questions that way as well. So with that, I would like to invite Dr. G to the stage. All right, thank you.